What if you were faced with a terminal, debilitating illness? Would you be prepared for the questions that lie ahead? What about ending useless medical treatment? And there's hospice, and of course, pain management. These and other questions we want to address today in part 2 of our special on end-of-life issues. Dr. William Bud Meyer and his wife Heidi have a long history serving our country in medical and military capacities. Dr. Meyer served on a hospital ship in the Navy and the Marine Corps during the Korean War. He was the only physician assigned to a medical intelligence study on the American POWs released from Korea. And then,
after working for a while in Department of Health and Human Services, I was invited to go over to the Pentagon by an old friend, Casper Weinberger, who had worked in California for Reagan as I had. And so we were all known to each other and friends. We were referred to as the California Mafia. And for 6 years, I ran all the health services for all the armed forces worldwide. About 10 million people in uniform and their families and their retired members. And that was a great adventure. So after working in the National Academy of Sciences for a year and a half, running an international forum on AIDS research, and I took a job up in Pennsylvania in a managed mental health care organization to see what that was like.
Meanwhile, Heidi was working as a control officer in the Office of Foreign Disaster Assistance, where she covered Central and South America and Africa.
3 or 4 years prior to that, I was commissioned into the Navy Reserve Nurse Corps because I would come back from these disaster-stricken countries in Africa or Central South America, and I'd tell Bud, my God, we've got it so good in this country, and we take it for granted. And I had this need to do something in addition to what I was doing in my job, and I knew there was a shortage of registered nurses in the military services. So without checking with him, I interviewed with the Air Force, the Navy, and the Army, and decided to go Navy, put my application in, it was approved, and I was commissioned in his office.
They had the prettiest uniforms in it.
Never dreaming I'd be mobilized. And Desert Storm comes along, I'm mobilized, and within a week, Bud had his first serious heart attack, and we didn't know if he'd survive. My first action was to try to get out of the Navy to take care of him, and the last person in the world they were going to release would be the wife of the former assistant secretary. So I did my 6 months, he survived. I was very grateful that I had the opportunity to serve the country during this time. And when the Navy released me, we had sold our house that same week. Bud had, because of his heart attack, had not resumed the job in Pennsylvania, was recuperating, and we put everything we owned in storage and headed west.
Let's fast forward now to where you are now. Tell me about when you found out that your time here on Earth was limited.
So we came out here. We have this splendid military medical center 11 miles from this house. We checked in there to arrange for my continued cardiac care in view of the fact that I'd had one coronary already, and then I had a stroke. Well, as is so often true when you get around 80, these things start to combine and add up. And I'd been diabetic for a long time, but it wasn't a problem. Managing that in the face of both the stroke and the heart disease started to get very complicated.
Then he went into kidney failure. But we're managing, we're managing.
So by about 4 years ago, from then on till now, my health has been so bad that I'm essentially useless.
Well, it was about a year and a half ago he started having very severe episodes of angina. They got so bad, so I pleaded with his doctor to please give me some injectable morphine. because he was taking up to 5 nitroglycerin and the pain was intolerable. He said it felt like an auger was drilling through his chest. So his doctor did, and I was shooting him IV morphine, you know, and I'd get some in the vein and some would fall in the tissue, and I was afraid I'd give him too much and kill him, and how would I live with killing my own husband? So,
She's sensitive.
you know, I asked this doctor to please make a referral to hospice. I needed help, and he declined. And a month later, after going through the IV morphine, which would make Bud throw up for the next 3 days and have to carry a bucket around because he was
very embarrassing.
The morphine was causing that. After a month of that, the doctor relented and made the referral to hospice. We just saw his doctor yesterday, and he acknowledged that it's very hard for a physician to make a referral to hospice because it's an acknowledgement of failure. It's very difficult for them to do. And
Well, it means they think you're going to die pretty soon. So you might as well face it.
A majority of people aren't aware of the end-of-life care provided to them and their families through the nationally available organization known as hospice. This organization focuses on caring for a person who is terminally ill, and oftentimes this occurs in the patient's home. Each hospice nurse specializes in comfort care and pain management, so the patient can die with dignity naturally. When we return, we'll learn more about the options available through pain management.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.
Dr. Mark Colgren is a resident of Portland, Oregon, where physician-assisted suicide has been legal since 1997. Recently, the voters in Washington voted in favor of the Death with Dignity Act, making Washington the second state in America to legalize physician-assisted suicide. But this left Dr. Colgren questioning how much voters really knew about allowing doctors to help a patient commit suicide.
The reason that the legislation passed, to some extent, is out of a sense of confusion partially and a sense of frustration amongst many people, feeling that, well, you know, if I was in that situation where I had a terminal illness, I would opt for assisted suicide because it would give me a sense of control. I mean, I think any of us can understand that part of it. But for the non-medical part of the community, what they may not be aware of, and again, I don't think it certainly wasn't promoted by the proponents of assisted suicide, is the advancements that have taken place in treatment of chronic pain, or the advancements that have taken place in the treatment of depression, and essentially the whole idea of palliative care as a viable, good option for end-of-life care.
When people know what kind of quality care and what kinds of real end-of-life choices are available for them, then they're not exploited by the kind of fear that proponents of assisted suicide use to manipulate people into being in favor. When people say, oh, I already have the choice to refuse care. You know, I can have good quality hospice care. All these boogeyman stories about people dying, you know, in horrible pain and discomfort. Sometimes people do die that way, but they should not. And I can tell you, as a person who has an expertise in end-of-life care and in pain management, that people should be dying comfortably and with real dignity, and they don't need assisted suicide to do that.
Palliative care has come such a long way than when I was a young nurse. We used to actually not give enough pain medication, truthfully. We let patients suffer. And now we keep patients comfortable. And we use what they call the law of double effect, in the sense that if I give morphine to a patient, I know that in all probability it will shorten their life a little because it lowers respiration and all that. But I'm not giving it to them to shorten their life. I'm giving it to them for comfort. And that makes it okay ethically.
Do you think there's such a thing as uncontrolled pain?
Sure. I mean, because by definition, if somebody is dealing with a bad pain problem and whatever's being done for that person medically is inadequate through no fault of the patient's, that's uncontrolled pain. And I know from experience, as do my colleagues around the country and around the world in the field of pain, that the right response medically and the right response in terms of what's ethical and following the Hippocratic Oath would be to identify the problems, try to diagnose what's going on, and intervene. If we treat the pain, if we give the patient a lifeline to hope and show them that, you know, we may not be able to cure their problem, we may never be able to cure the problem, we may never get them to a complete 100% reduction of this symptom of pain. But if we can help some, if we can help give them hope, if we can help give the patient control over their pain and a sensation of being back in power of their own body and condition, and treat their depression if it's there too, guess what? They're not asking for suicide anyway. I think what's happened is the argument's gotten confused and muddled, because instead of advocating for better training of doctors in the arena of pain control, better identification and treatment of depression, now all of a sudden an option's out there that patients may endorse, saying, well, you know, I'll just ask for assisted suicide.
Well, what drugs are they prescribing to kill patients?
Primarily it's barbiturates. They're overdoses of sleeping pills or of a sedative medication in the barbiturate line. So they will use drugs that are taken orally, they make them into a slurry, 90 short-acting pills like Seconal.
How long does it take to kill a patient?
Well, the reports say that some people are dead in minutes, which is almost too fast for the drug to get absorbed, but that's what claims are there. And then sometimes they go literally days without dying, like as in the case of David Pruitt, who did get reported in the Oregonian. He took his cocktail recommended by the so-called Compassion Choices group, and 67 hours later he woke up. I thought I was supposed to be dead. He somehow had an epiphany, having not killed himself, and said, well, gosh, and he said all this, he said, God must not want me to die. And so he continued to live for at least 11 more days and died peacefully, naturally, with dignity, without taking an overdose. And I think his wife was quite grateful, and I think she said so in the paper. So this is, he unmasks this whole paradigm of this is a great way to kill yourself. Number one, taking overdoses. Ask any emergency room doctor, it's not all that pretty necessarily.
The people of Washington do not support assisted suicide, and in fact our polling shows us what it showed in every other state, which is that when people are educated and really aware of what assisted suicide is, then they oppose it. Radical proponents of assisted suicide dump money in here to subvert, I would say, the will of the people of Washington and manipulate them into voting for something without being aware of really the ramifications of such a law.
When we return, Dr. Meyer talks about the truth behind dying with dignity.
Thank thank you for inviting us into your home. Each week we feature real people who deal with real life issues head on. Some of their experiences are uplifting, while others will break your heart. But in the end, the message is clear. Those who follow biblical principles on the issues of life are blessed. Become a partner with us in providing a positive, life-affirming message to help change the way the next generation values innocent human life. Please consider a generous gift to help offset the costs of producing this important quality programming. You can donate on our secure website at facinglife.tv or by calling the phone number on your screen during normal business hours. Together, we can make a real difference for life.
The United States is following in the steps of the Netherlands, which legalized physician-assisted suicide in 1993. Since then, studies show an estimate of 6 to 10% of all deaths there are a result of patients seeking their physician's assistance to die. Oregon and Washington legalized physician-assisted suicide, and Hawaii has been petitioning to legalize it since 2007. Recently, a Montana State District judge ruled in favor of one's right to assisted suicide. Should we be concerned governments are allowing a doctor to become an agent in death?
Do you think that Washington's Death with Dignity Act is a reflection of the decline in moral values of the nation?
Absolutely.
Plus ignorance.
The intentions of that act superficially seem compassionate, caring.
I'd have voted for it 2 years ago. Death with dignity, everybody wants death with dignity. As a health professional, I want patients to have dignity when they die. Of course, I'd vote yes.
On the other hand, I've watched a lot of people die, and there is nothing undignified about dying. Any more than there's anything undignified about being born.
Right.
A newborn is a slimy, sloppy, screaming, red, complaining little creature. Undignified? No, I don't think so. You're seeing life emerge just as in a dying person, you're seeing life depart. And while sure, some dying people lose control of their bladder and bowels and they drool, but most people don't. Most people quiet down as they die. Most people, like me, no longer too interested in eating. You find yourself surprised that you've been able to sit as long as you have in one position because you never did that before in your life. I'm not lonely. I don't mind being alone, but then neither does Heidi.
But I've had the most loving feelings taking care of him this last part in his life. It's drawn us ever closer in a way I never would have anticipated.
I had a patient years ago in a little town of Crescent City, California. A very nice lady who worked as a checker in our only supermarket in Crescent City. She came to me for help. She was terribly upset. She'd been upset for several weeks and was so upset she couldn't work. So I took a careful history to find out how long this had been going on and what set it off. You know what set it off? One of her customers, whose name she hardly knew, had committed suicide. And she got to thinking about it, and she thought, if I'd only been a little nicer to her, especially on days when she looked down in the dumps, maybe she wouldn't have done that. So I'm partly responsible for that woman. Parents never recover when even an adult child kills himself. They carry that around. It's impossible for many people to get rid of. They blame themselves no matter whether they have any responsibility for it or not. And that's invariably true in self-imposed death. Now, supposedly the family doesn't need to know about this in the case of a patient who gets poisonous medication from a physician. But you know, that sort of information somehow always gets out. And that means that some unforeseen number of people with unevaluated relationships with that person are going to have emotional reactions, if they're sensitive at all, to that act of violence, which is what suicide is. It's the ultimate act of violence, and it is the most hostile act that you can perform.
Coming up, Bud and Heidi share their secret to facing each new day despite the reality of Bud's terminal illness.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.